Hello, this is Ju Won Suk of Wooridul Spine Hospital. Surgical procedures often involve removing or cutting parts of the bone. At Wooridul Spine Hospital, a single-direction endoscopic procedure does not involve bone removal. This is a great treatment because only the ruptured disc is removed. After the procedure, many patients are discharged on the same day. Since patients recover so quickly, they often think that once the procedure is done, they are completely healed. However, this is not the case. For example, the disc at the fourth and fifth vertebrae is ruptured. The procedure is performed to remove the ruptured disc. The nerve is relieved, so patients feel much better. However, the disc is still in poor condition. Removing the ruptured disc only relieves the pressure on the nerve, but it does not improve the condition of the disc itself. However, after the procedure, when the symptoms improve, patients often believe that the disc has also improved. It is essential to be cautious because, fundamentally, the disc can still relapse. As mentioned earlier, the fourth and fifth vertebrae are weak, making it easy for them to become herniated again at any time. There is always a risk of recurrence, so you need to be especially careful for at least 1 month. It takes about a month for the area where the disc ruptured to heal and become stronger. Of course, this can vary from person to person, but generally, after a certain period, the risk of recurrence decreases. There are cases where patients, feeling much better early on, are discharged quickly and return to work, only to come back later with pain again. So it's essential to be cautious during the first month. While it may not be necessary to wear a brace at all times, it is recommended to wear one for the first month as a precaution. There are a few things I always tell my patients. First, you should avoid putting too much weight on your back. If there is excessive pressure on your back, the disc between the bones can herniate, so you should avoid situations where your back is compressed. This means avoiding lifting heavy objects or sitting for long periods. It is also problematic for the disc to bulge outwards. That is, when the disc bulges backward, it affects the nerves located behind the disc. If you bend forward, the spine collapses, and the disc can herniate backward more easily. If you frequently bend your back, the disc may move further backward, increasing the likelihood of recurrence. So, avoid frequently bending your back and lifting heavy objects that put a strain on your spine. It's crucial to be careful for at least a month, but you should continue to avoid these postures afterward as well. Of course, work and other responsibilities still need to be carried out, but you should try your best to avoid bad postures to protect your back. Ultimately, it would help if you made long-term changes to your lifestyle. It is important to be mindful of your habits.
Are there certain exercises that you can do after the procedure?
Of course, it may vary depending on the doctor, but I recommend focusing on walking for the first month. After the first month, once the brace is removed, you can start doing core exercises such as the Superman pose or planks, which are well known for strengthening the core. These exercises are ideal because they don't require bending the back, so they're less stressful on the spine while helping to strengthen the back muscles. These exercises are beneficial to start 1 month after the procedure. Surgery does not restore your back to its original condition. Many people are disappointed because whether they undergo surgery or a procedure, they don't return to their pre-injury state. However, it's crucial to understand that managing your back is a lifelong task. For the first 1 or 2 months after surgery or a procedure, you need to be especially careful. After that, it is important to follow lifestyle changes and habits to protect your back in the long run. Thank you. This was Ju Won Suk of Wooridul Spine Hospital.